Hi, I'm Dr. Rooma Sinha, consultant gynecologist, laparoscopic and robotic surgeon, and honorary professor at Apollo Hospitals. Today we are going to discuss a common problem in women, and that is uterine fibroids. So what are uterine fibroids? Well, uterine fibroids are just tumors in the uterus, and this can be seen in women in their reproductive age group. So, right from the menarche till menopause, one can be diagnosed with uterine fibroids, which are by and large non-cancerous conditions. These fibroids, when they grow in the uterus, they make your uterus grow large in size and cause various signs and symptoms. The signs and symptoms of fibroids can be, number one, heavy menstrual bleeding. And that's the commonest reason why women walk into our office and we diagnose them to have fibroids. The second common reason, a second common problem that these women can face is pain during their menstrual cycle. And that can be very distressing to these women, and they often need medication to have relief. The third commonest problem with fibroids, as I said before, is because these fibroids enlarge your uterus, they can simply present as a mass. You may think you're just gaining weight in your tummy, but actually they are growing fibroids in your uterus. The other things these large fibroids can do can cause pressure symptoms in the bladder in front of your uterus, which will make you go to washroom or to feeling of passing urine very often. Or they may grow backwards and put pressure on your rectum, and that may cause you some types of constipation or difficulty in passing motion, or simply a feeling of heaviness. Some of these fibroids can cause postmenopausal bleeding. That means you had a fibroid, you never knew. You are already in menopause, you thought everything was over, but you now present with some bleeding, and that could also be one of the reasons or one of the symptoms that these fibroids can present. Sometimes women do not know that they have fibroids, but infertility, they present to us, and when we look into for reasons for fertility, and then we realize that the fibroid is causing the infertility. So these are the common signs and symptoms of fibroids. What can cause the condition of fibroid uterus? Well, there are many theories, many hypotheses why women develop fibroids, but the bottom line is it's just like any other tumor. Some of the cells in the uterus have a different makeup. That means there is either a genetic, epigenetic factors, or there is a predilection for them to develop into fibroids. And then these women have a tendency to develop fibroids. How common is fibroid? Well, it's not very uncommon. Let me put it this way. It's hard to put a figure, but there was a recent study from India in which when regular patients in the gynecology OPD were evaluated, about 25 to 30% were diagnosed with fibroid uterus, whether they were having the symptoms, which we mentioned earlier, or they were asymptomatic. So fibroid is not very uncommon and can be seen in many women. How is fibroid diagnosed or tested? Well, fibroids, as I said, is a tumor which enlarges your uterus. So the commonest reason how we diagnose as gynecologists is to examine a patient. We do an abdominal examination, we also do a vaginal examination, and we can find that the uterine size is enlarged, and we suspect that this woman may be having fibroids. What do we do then? The commonest investigation that we advise for these women is ultrasound. And the ultrasound is a very good imaging technology to diagnose whether the woman has fibroid or not. Number two, how many are there? Number three, where are they located? What are the size of these fibroids? Finding all these information on imaging will give us an idea how much trouble this fibroid is going to give you and what should we do for that. If ultrasound is not enough for us to get all the answers, we even advise an MRI or a magnetic resonance imaging, which gives a much more detailed and clearer picture to understand the location, size, and how these fibroids are placed, which gives us not just to make the diagnosis, but also to plan the treatment for you. Is fibroid treatable, and what are the options? Well, fibroids are 100% treatable. There is no question of not being treatable. But the question arises, what is the type of treatment that we may subject a woman with presents with fibroid? You have to understand this. Fibroids can be diagnosed in a completely asymptomatic woman. That means the woman has fibroids, but we incidentally diagnosed when we did an imaging. Some of these women may not require any treatment. What is the impact of fibroid in the quality of life of a woman? That's a very good aspect to discuss when women suffering from fibroids come to us. As you understand, I already mentioned fibroids are non-cancerous condition. So there is no need to be in any hurry or rush to do surgery or any intervention for these women. But we must understand that because of the bleeding that they suffer, because of the pain that's associated with this bleeding during menstrual cycle, these women have a very poor quality of life. Can fibroids lead to infertility? Fibroids and infertility do exist together. By that I mean that when women come to us that they are unable to conceive, often we find that these women have fibroids. But there is a catch. Does not mean that all women with fibroids will never conceive, right? So we have women who have fibroids, conceive, carry the pregnancy for 9 months, deliver and have everything fine, which could be any size of fibroid, but the location is important. When women presents with fibroids which is jutting into the cavity of the uterus, those are the women in which we know that they are unable to conceive, they may have recurrent abortions, they may be unable to continue with the pregnancy for the full 9 months. So these are the problems. Some women, because of the presence of intramural fibroid or fibroid in the wall of the uterus, can cause abnormal contractions in their uterus. These can also result in difficulty in conceiving or implantation during the pregnancy cycle. So fibroids and infertility are associated, but you must remember that not all fibroid patients will present with infertility, and removing fibroid doesn't guarantee a pregnancy. Does fibroid cause problems during pregnancy? If a woman has already conceived along with the fibroid, it depends upon how big the fibroid and the location of fibroid. Some women can continue with their 9 months perfectly fine without much problem, maybe a little discomfort here and there, but they are able to carry on with the pregnancy and deliver a live child. But some women with large fibroids or abnormally located fibroids can have miscarriages, can have early delivery, that means preterm baby, and the problems associated with preterm. So intrauterine growth retardation, that means the baby, if there is a very large fibroid, so there is a space problem in the tummy, either the baby will grow or the fibroid will grow, and fibroids also grow during pregnancy sometimes. So they will change their shape and size. So these are the problems that a woman can face if she is pregnant along with a fibroid in her uterus. And then at the time of delivery, location of the fibroid can cause difficulty in having a normal delivery, and these women may sometimes have to undergo a cesarean section, which can be technically challenging because it may be just present at the place where we want to make a cut and take the baby out from the uterus. So if there is a fundal fibroid, that means if this is the uterus, fibroid is here, not much problem and the delivery can take place. But if the fibroid is right here where we want to cut and get the baby out, we have technical difficulties, and one must be very, very careful in handling such patients. Can diet and lifestyle cause fibroids? I think diet and lifestyle should be improved irrespective of fibroid or any other condition. But yes, specifically when we talk about diet and lifestyle, we know that fibroids are fueled by hormones. I mentioned that in the beginning. These hormones are produced not just by the endocrine organs that we have, but like a hormone called estrogen can be produced in your fat cells. Thank you. Take care of your health. Namaste.